Good evening, everybody. My name is Dr. Punam Dixit. I'm a gynecologist practicing in Patna. I offer comprehensive services in gynecology and obstetrics, and the care of young adolescent girls is one of my special interests. So, today we are going to talk about polycystic ovarian syndrome. These days, it has become more common and it causes a lot of anxiety in the girls as well as her mother and whole family. So, what it is actually in polycystic ovarian syndrome, the ovaries are larger than normal and it has twice the number of follicles. These are the mm, eggs which are released in every menstrual cycle. So, they increase in number. So, often girls come to us with a report of ultrasound which shows that there are many cysts. And will it go? Will they need a surgery? So, the answer is that this is just one symptom. Polycystic ovarian syndrome is a combination of, it is a disease which due to hormones. There are two hormones which are incriminated in this condition. One is the testosterone, and the higher levels of testosterone are found in girls who have polycystic ovarian syndrome. And another hormone is insulin. The level is quite high. The reason being that cells of the body do not respond to the insulin level. So although the insulin level is high, the whole metabolism, the glucose metabolism, which is controlled by insulin, is affected. So these two hormonal imbalances cause increase in weight. The lady may have infrequent periods or no periods at all. There may be acne on the face. Sometimes they have psychological problems like depression. Increase in weight can cause sort of, like an altered body image, and that can contribute to depression and anxiety in these girls. And lastly, which is quite common with polycystic ovarian disease, is they may have problem in conceiving. That is getting pregnant is can be more difficult than a woman who has got no polycystic ovarian disease. But that is not a cause of concern because these people can be helped with medications, lifestyle changes. And what is very important is that regular exercise and weight loss. Say weight loss of even 5 to 10% causes dramatic increase in the hormonal levels and the symptoms these ladies have. So these are the basic background information about polycystic ovarian disease and why it is important. One, I said that the irregular periods and then difficulty in conceiving, but it also has certain long-term prospects like increased incidence of diabetes, hypertension, and when they grow old, say 30 plus 35, 40, they have a higher incidence of cancer of the uterus. So all these conditions can be controlled and prevented. I mean, the side effects of the polycystic ovarian disease by lifestyle changes and appropriate treatment at appropriate stage of life. I'll explain this in bit more detail that this syndrome is a common condition affecting many organs of the body. And the symptoms and the treatment will vary depending on the age and requirement of the person. So young girl is just concerned that she's overweight and her periods are not regular. She's getting acne. There is more hair on her face or body. So that's the reason we want to counsel them. So the most important aspect of treatment is understanding the condition. So people ask, will it go? Is there a cure? It can only be controlled, and some symptoms vary. Sometimes they are more severe, sometimes they are less severe. So yes, treatment is available, and lot of is in your hand. You can sort of have a regular exercise, walk, meditation. Excessive stress is also a contributory factor. Often it runs in families. If your aunt, if your mother or somebody had it, then you're more likely to have polycystic ovarian disease. And About the diet control, I would say that having a balanced diet, which is like with onset of COVID infection, we have all become very, very conscious about our nutrition and what we eat. So we need to have a healthy balance of complex carbohydrates, not to have refined, like, like this refined flour or so we always need to have complex carbohydrates, protein should not be neglected, either vegetarian or non-vegetarian, and healthy oils which are rich in omega-3 fatty acids. So the nuts, there are healthy nuts like almonds and walnut, which are rich in omega-3 fatty acid. People who eat non-veg food, for them, fish is a very good source of omega-3 fatty acid. And a regular exercise, you don't have to spend hours and hours in gym, but just walking, a brisk walk for half an hour daily, like it has to be part of our routine. Many young girls who come to clinic, mom will say that, oh, there's no time, she's busy in coaching whole day long. So no matter what your lifestyle is, just do include a regular exercise, whatever you like. Exercise, say, if you like dancing, then you can dance, and that's a good activity. If you like walking, skipping, because in many schools, now schools are closed, games and sports used to be part of the curriculum, but often children are missing it, and most of us live in apartments. So the physical activity becomes restricted by default. So one message to all the mothers, fathers, and young girls, that physical activity is very important. Even if you're not able to lose a lot of weight, the activity itself makes your cells more responsive to the insulin you have in your body. Then we're talking about the how do we control it. There are many ways we can control the cycles, that is by giving contraceptive tablets, which is although given for contraceptive tablet, but it's a very good treatment for polycystic ovarian syndrome. And there are specific treatments which your doctor will provide as and when you have the symptoms. Now we move on to the questions. So there are many questions. Ritu has asked, Sneha has asked that I have been diagnosed with PCOS, but don't have a problem with weight gain. Would the natural hormone solution still work for me? Yes. If you are not overweight, then you come to a category. There are certain ladies with PCOS who have normal body weight. So tablets can be given to regularize your periods, and that will work. Ayali has asked, having been diagnosed with PCOS, can I consider having an IUD inserted to regulate my menstrual cycle? See, if you have polycystic ovarian syndrome, you're more likely to have very infrequent cycle or no periods at all. So a very good intrauterine system which can be fitted in, that is a hormone releasing intrauterine contraceptive device, and that is very, very good for women who have polycystic ovarian disease, because it protects the lining of your uterus. It will not regulate your cycle, but it will protect you from the excessive hormones you have due to PCOS. So you can request your doctor. That's commonly known as Mirena or Emily, and that's a very good thing for ladies who have polycystic ovarian disease, and fertility is not an issue. Rachna, can surgery treat polycystic ovarian syndrome? I discussed in my talk that these tiny cysts, they do not require any surgery. It is mostly treated medically and by lifestyle changes. Very rarely, when women are having problem getting pregnant, little holes are drilled in these ovaries so that they can have ovulation. The eggs are released and it favors them, but that is a in very small percentage of patients we would do that treatment. Ritu has asked how many pills are there to take every day. Well, it depends what pills you mean. If it is contraceptive tablets, then it is just one every day. And I don't think there are a lot of, and there are certain other medications, so we should not be putting you on too many tablets. Pooja, what are the symptoms of PCOS and how they relate to insulin resistance? See, the symptoms I have already talked, the infrequent cycle or no periods at all, excessive acne on your face, excessive hair growth, and problem in conception. So it is all excessive testosterone, insulin, and they all lead to a very high level of estrogen in the body, and that causes polycystic ovaries. Prachi, how do I manage my PCOS without medication? I only have mild acne. Uh, Having a weight which is ideal for your height is one goal, and regular exercise. And very mild acne can be controlled by the oil, using a good moisturizer, washing your face frequently, and consult a skin specialist. Sometimes they do suggest to use some creams for the mild acne. Now, Lex Kapoor, can gaining weight must be the reason for irregular in periods? See, gaining weight is not the cause. Gaining polycystic ovarian disease has many symptoms, of which excessive weight gain is one of the symptoms. Lakshmi Mishra, my sister's period is late, but she's not pregnant. Why does it happen? There can be many reasons for it, and if it is just one off, then there's not much to worry about it. If it is happening on regular basis, then we have to investigate further. One life cycle. So these are the questions which I have more or less answered. And one symptoms which I did not discuss, that they can also have excessive hair loss from their head. That is also one of the symptoms of polycystic ovarian disease. Bhavna. Bhavna has asked, I got delivered 4 months back, but I still have not got my period. Is it normal? Yes. It's very, very normal, Bhavna, to have no periods after delivery, because I guess you might be breastfeeding. So breastfeeding can cause no periods, but I will advise that you should use some contraception, because many women do get pregnant while they are still not having any periods. Rashi has asked, I have been diagnosed with PCOS. What support can you offer me? Rashi, I need a bit more clarification. How old are you? How were you diagnosed? So, as a doctor, I also do online consultation, so you can consult me. And the support will be like explaining to you what you have, the prognosis, and what specific treatment you need at this stage in your life. So, you can always consult me or any other gynecologist for this problem. Uma, how can I lower the risk of complications? See, one is the gold standard, which has come again and again in my talk. That is the lifestyle changes, which should be, like just across the board. That's the message. And about the specific complications, say diabetes, if you control your weight and you walk, then you are less likely to get diabetes and hypertension. And in one of the answers, I have discussed that increased incidence of cancer in the lining of the womb that can be prevented by inserting a hormone releasing intrauterine contraceptive device, and a regular follow-up, a regular ultrasound should be done in women who are older than 40 and who were diagnosed to have polycystic ovarian disease in their life, in younger life. Vandana has asked, what should I not eat with polycystic ovarian disease? See, the diet in polycystic ovarian syndrome is a has been discussed a lot, and I did say what we should eat. So there aren't taboo foods for polycystic ovarian syndrome. Broadly speaking, avoid excessive sugar, avoid refined flour, and one weight loss method which has become very popular, that is intermittent fasting, that there is some evidence that it works, so that you can always start under the supervision of a dietitian. That would mean, like, like keeping gaps between your two meals. It can vary from 10 hours, 12 hours to 14 hours, but I suggest that you do it under supervision and go gradual with this method. Apurva has asked, do I need to take birth control pills? Yes, Apurva, if your cycles are very irregular, then contraceptive tablets are a very good option to make the cycle regular. They also control excessive hair on your face. They also control acne. So, not for the purpose of contraception, but for regularization of cycle and control for the symptoms, contraceptive tablets are a very good option. And that is our first line of treatment. So, while waiting for more questions, I'll just cover what I have not talked so far. So, a few things which I see in my clinic quite often. Just having a polycystic ovary in ultrasound does not mean you have PCOS. With this, you should have other symptoms like which I have discussed: infrequent cycle, less period, excessive hair growth, and certain blood test which shows more testosterone. So diagnosis is not made by ultrasound alone. And also, in girls younger than 16 years, there is no role of doing an ultrasound because they will have irregular cycles, and that is not the time when we diagnose PCOS. So we should, even if somebody has done it for you, wait until you're 16 years old, and do not, label makes everybody very anxious. So we have to refrain from that practice. Somebody asked me what help we can offer. See, in many places there is a PCOS club. So it has a treatment offered jointly by a gynecologist, a dietitian, and a physiotherapist. And also, there are girls, so you have support from the peer group. It is very easy to say that you do regular exercise, you lose weight, but in putting it in practice becomes difficult, and having a support not only from experts but from your peer makes it easier to achieve. So PCOS club is a good option. Not many places have, but some places do have that PCOS club where people. Madhuri has asked, will PCOS delay pregnancy? Yes, Madhuri. What happens is that fundamentally, why? Let's understand why a girl has regular periods, because every month egg is released from the ovary, and that does not happen when you have polycystic ovaries. That ovulation is delayed, and to conceive you need ovulation every month. So polycystic ovarian disease does cause delay in conception, but it does not mean that they cannot conceive. Many women of PCOS, they conceive without any treatment. So if you do not have periods, it is a useful thing to do your pregnancy test. And there are medications given which causes release of eggs every month, and that is the first line treatment when women are not conceiving. I think that answers your question, Madhuri. Sonam Patel, there are times when you miss your periods but is not pregnant. What does that mean? I think I did answer in one of the queries. It can just be one off thing, or it can be a sign of certain conditions, and PCOS can be one of them. There are many other causes which lead to cessation of periods. Certain medications can cause no periods for some time. Bhavna has asked, is it normal to skip a period for 3 months? If it is happening, say, once in a year, then it's okay. But then, even then, I think it's better to consult. It's not very normal. No, it doesn't happen with a lot of people. Durga Salvi has asked, how will PCOS affect my fertility? I think I did answer that question. Many women of PCOS conceive just when they have managed to have some weight loss, and that is, say, about 5 to 10% of weight loss. So, if you go to a doctor and they say weight, because I know losing weight is very difficult, so even a 5 to 10% of weight loss causes resumption of normal periods, and you can conceive. Rebecca has asked, what causes irregular periods? So it's same, the eggs not released every month, and that is the cause of irregular periods. And the fundamental cause is the higher level of testosterone, which girls with polycystic ovarian syndrome have. So it has been a very nice being with you all and answering your queries, because when you have a medical problem, understanding of disease solves most of the problems, because the related anxiety makes life very uncomfortable. And go by remedies which are scientific, and not go by, like, somebody promises some medication, some food, or some food fads. So there isn't the scientific evidence to treat or cure polycystic ovarian disease. And do not get depressed that it is not a treatable disease. It can go on its own, and there are many ways by which you can control it. So this is the end of my talk on polycystic ovarian syndrome. I would like to conclude here, and I'm Dr. Punam Dixit. I practice at Patna, and name of my hospital is Punam Surgical and Maternity Hospital, and we provide a comprehensive range of services for in women healthcare, including right from very young girls to the extreme of age. And um, we offer a balanced treatment where the dietitian and physiotherapist and the other aspects of treatment are available. Very specialized treatment when it is required, we offer that also. So, thank you very much.